I would like to introduce Dr. Dan Rossignol. He is a physician with special interest in autism. We're going to be talking about how to navigate through biomedical treatments for a child with autism. Welcome, Dr. Rossignol.
Thanks, Kristen. I'm happy to be here and talk about this.
Yeah, I definitely think, especially with the numbers increasing, this is something that we really need to talk about and address. Before we get started, can you tell me how you got involved in treating children with autism?
Well, it's an interesting question. It's not something that I ever started out to do. I have two children who have been diagnosed with autism, and that led us, my wife and I, on a search to see what could be done. And initially, it was really my wife who talked to other parents, did research, and kind of got me involved more in treating children with autism. So she got me to go to a conference where evidence was presented about different treatments for autism, and that got me very curious. And then I started doing some research and starting to get involved and started treating a few children in my practice with autism, and then it kind of grew from there. So most of the children I treat now in practice have autism. And I do this mainly to help my kids, but also obviously to help other kids as well. And looking back now, it's a career path that I would never have chosen for myself because I really didn't know a lot about autism at the time. But it's funny how things work and how God sometimes will put things in your life to change the course of where you're going. So I never thought I'd be treating kids with autism, but because I have two kids affected, that's now what I do.
Now, let me start with a very basic question. So we're, basically all on the same page. What is autism?
Well, it's good to start with that because we have to be starting, like you said, on the same page. So autism is really a collection of symptoms. It's a description. So there's some subjectivity to the diagnosis. That's why if you see different providers, you might get different answers. One might say it's high-functioning autism. Another person might see it's more of an Asperger's syndrome or whatever. So at a core, with autism, there's problems in speech, social interaction, and repetitive behaviors. So if you have those three things, then essentially that's what makes up autism. But we don't really have any way of objectively identifying autism. For example, we have a blood test that you can do for diabetes, and it tells you that you have diabetes. But we don't have a blood test for autism, unfortunately. So we have to go based on the symptoms. It's also a spectrum disorder, which means some kids are more affected than others. Some kids are very severe, and some kids are less severe. But ultimately, the diagnosis of autism doesn't tell us what's causing it, and that's what we want to try to sort out.
Now, what does it mean when a child with autism is high functioning?
Well, high functioning generally would refer to the symptoms. So if the child has, mild symptoms of autism, for example, maybe their speech is slightly delayed, or they have a slight amount of repetitive behaviors like flapping their hands and so forth, but it's not severe, they might be considered more high functioning. And generally those kids tend to improve more quickly over time, as opposed to a child who might be lower functioning, who maybe doesn't speak at all, or doesn't sleep throughout the night, or is being very aggressive. Oftentimes the treatment that we target is a little bit different because children who are higher functioning, we may not have to be as aggressive with treatment as if they're low functioning.
Okay, and now how many children are affected with autism in the United States, really for the matter in the world?
Yeah, this has been tracked now for quite a while. The most recent statistics that have been put out is about 1 in 45 children in the United States have a diagnosis of autism. That's all comers. The number of boys that have autism compared to girls is about 4 to 1 as far as the ratio, which means about 2.5% to 3% of boys in the U.S. today have a diagnosis of autism. So it's very prevalent, very common. And if you look at other countries like the United Kingdom, look at South Korea, where there is published data, it's about the same, about 1 in 40, 1 in 45, somewhere in that range. There are some countries where we just don't have good data, for example, China or Japan, where I see a lot of patients from actually don't have a lot of good data there, but it does seem to be highly prevalent as well. So it seems to be a worldwide problem, not just a problem we have in the United States.
Now, are there any FDA-approved treatments for autism?
There are two medications. One's called aripiprazole, the other one is risperidone. These are antipsychotic medicines, and they're approved to treat irritability associated with autism. It's interesting, if you look at the core features of autism, we look at what defines autism, irritability is not one of the core features. Again, the core features are speech problems, problems in social interaction, and repetitive behaviors. So we don't have right now any FDA-approved treatments that treat these core autistic symptoms, that being the speech, the social interaction, the repetitive behaviors. The only two medications that are approved are the ones that help treat irritability associated with autism.
Now, okay, so here's another question. Since we're talking about biomedical treatments, what does the term biomedical mean?
That's a very good question, too. I took biochemistry when I was in college. I had it again in med school. And then when it comes to treating kids with autism and looking at these problems, I had to learn biochemistry all over again. Biochemistry mainly refers to the chemical processes that occur in the body and how these processes function to sustain life and provide energy. So there's pathways involved with the biochemistry that help produce things like energy and chemicals and things that you need to survive. And there can be blocks in some of these pathways. For example, there's a disorder called maple syrup urine disease where you get a block in the pathway that breaks down branched-chain amino acids. And this is caused by a deficiency in the enzyme that breaks down the amino acids. And this can lead to neurological problems. It can lead to mental retardation. It can even lead to autistic symptoms. The way it got its name was the urine tends to smell like maple syrup. So there are some classic metabolic disorders that you might find in some children that can cause autism. But in many cases, we're talking about problems that are a little bit more subtle. They may be not optimal. For example, the pathway might be weak, but not completely blocked like it would be in some disorders. But we can look for these problems in biochemistry, and we can find things that we can then target a treatment for. So for example, if we find something is low, like there's not enough iron, enough zinc, and so forth, which might affect biochemistry, we can then add those things in to support the biochemical pathway better.
And so what are some examples of biomedical problems in autism, and which ones are more common?
Well, this is interesting. So there's been a lot of research looking at this, especially over the last 5 to 10 years, and it's been better defined now. One of the most common, if not the most common, problems in autism from a biomedical or biochemical standpoint is mitochondrial dysfunction. The mitochondrial parts of the cell that create energy for the body. So if there's a defect here or a problem, you may not create enough energy, and therefore not create enough energy to run certain biochemical pathways. For example, there's been a few studies showing that mitochondrial dysfunction is found in some children in their brain, and this might affect areas of the brain that are responsible for things like speech and social interaction. So for example, if you're not creating enough energy in the speech area of the brain, then maybe your speech will be delayed. There's other problems that have been described too. There's a lot of studies now looking at inflammation and immune problems, both underactive immune system where maybe there's immunodeficiency, where there's not enough immune-related proteins to fight infections off, and then some evidence of overactivity where perhaps the immune system is attacking itself, for example, making autoantibodies to brain tissue. When you produce an antibody, the antibody is made by the immune system, and it helps you target things that are foreign, like a virus, for example. But some children with autism actually produce antibodies against their own tissue, and that might cause damage. So the immune system is not supposed to attack itself. It's only supposed to attack foreign things. Also, there's a condition of folate deficiency. We don't get enough active forms of folic acid in the brain, and that can lead to autism. There's some other things that maybe aren't quite as common. For example, hypothyroidism, an underactive thyroid condition, is found in some children with autism, and it's treatable, so you can give thyroid medication. And some kids who have hypothyroidism will have speech delay, attention problems, and so forth. There's quite a bit of nutritional deficiency that we find in some children with autism, even in some children with ADHD. For example, low iron has been shown to impair attention in some children. Low vitamin D might play a role in autism. There was a study published last year, a case report of a child with autism who had very low vitamin D. They gave the child vitamin D, raised the level, and a lot of his autistic symptoms got better. Some children with autism have low zinc, which can impair attention. Some children have low cholesterol, which might sound a little funny, but low cholesterol actually can impair brain function because part of the brain is made of cholesterol, and the brain needs fat and cholesterol. And there are now studies showing that low cholesterol can increase behavioral problems, and increasing cholesterol in children with autism will sometimes help their behavior. There was a recent study just published a couple weeks ago showing low B12 levels in the brain of children with autism compared to typical kids. So there's quite a few deficiencies out there that we can test and then treat.
And you're saying it's treatable, so these biomedical problems can be treated?
Yes, and so this is what we want to test for and try to identify, because treatment of some of these problems have been shown to dramatically improve or even in some cases reverse autism. The classic example is cerebral folate deficiency. This is where you end up with low active forms of folic acid in the brain. It's a vitamin, folic acid is, and If it's low in the brain, it can impair brain function. And children who have low active forms of folate in the brain develop a condition called cerebral folate deficiency, and quite a few of those children will develop autism. If you catch this early enough, identify it, and treat it, some studies have reported that you can dramatically improve or even reverse autism symptoms using an active form of folic acid called folinic acid. So we are concerned about this. The younger we can identify it, the more likely we are to get improvements when we treat. And some children with autism produce an antibody made by the immune system that inappropriately attacks their own folate receptor and blocks the uptake of active forms of folate in the brain. So we can identify this antibody in the blood with a blood test, and we can treat it with a high dose, usually available by prescription, of folinic acid. As you raise the folate level, active forms of folate level in the brain, oftentimes the autistic symptoms improve. Even things like seizures will sometimes get better. The younger the child is, when you treat this condition, the more likely you are to get reversal or improvement, which is why we like to identify these things early. So the reason we test for these biomedical problems is that many of them, or pretty much all of them, are treatable. Of course, every kid is different as far as how much improvement they get, but the point is that these things can be treated.
Now, I've heard, and I know many of us have heard this, that some doctors say that autism is genetic. What does that mean, and how do biomedical problems fit into this?
Well, certainly there are some genetic problems that can lead to autism. So if you compile all the data on this that has looked at genetic problems, you find that about 21% of children with autism will have some type of genetic abnormality that could be causing or playing a role in their autism, which means about 4 out of 5 kids with autism don't have an identifiable genetic problem that you can say, okay, that caused the autism. There certainly appears to be a collection of many genes. It might be hundreds of genes or more that come together and increase the risk of autism. So that's an active area of research, but it's hard to predict, which genes are going to come together in that way and contribute to a problem. It's now felt, based on some recent studies, that over 50% of the risk of developing autism is related more to environmental factors. And that's the good news, is that if most of this is not genetically based, or maybe there's some genetic abnormalities, but they're not severe, that means that the abnormalities we find in autism may be more treatable. In other words, sometimes genetic problems don't have a specific treatment, whereas if it's more of a problem in biochemistry but not related to abnormal genes, then maybe this condition is more treatable.
Now, in your opinion, which environmental factors are, playing a role in autism?
This is interesting. So we published a study a year or two ago kind of trying to look at the evidence up to that point as to which environmental factors are associated with autism. The one that seems to be the most prominent are pesticide exposure, especially during pregnancy or early childhood. So what we try to caution parents about is to try to avoid toxins, things like pesticides, as best they can. Eating organic food might be helpful too to avoid pesticides, but exposure to pesticides and other chemicals during pregnancy and early childhood seems to be one of the environmental factors most associated with autism.
Now, are there any genetic problems that you test for and that there's treatments available for these?
Yeah, so I just mentioned that, most of the genetic problems that you find in autism don't have a specific treatment, although there are a few that might. There's a gene called TMLHE, which is, as a recent study reported, was found in a small number of children with autism. This enzyme is involved with producing carnitine and can lead to carnitine deficiency. So treatment with carnitine might be particularly beneficial in children who have this mutation. Now, they only found this in a very small number of children with autism, so most kids don't have this, but it is something that can show up on genetic testing and could lead to potential treatment. There's another genetic test that we do called MTHFR, which is an enzyme that converts folic acid, which is inactive, to the active form of folic acid, which is called methylfolate. And defects in this enzyme have been associated with autism. In fact, children with severe defects in this enzyme are 2 to 3 times more likely to develop autism. The interesting thing with this is treatable. You can give active forms of folic acid, specifically methylfolate, to bypass this enzyme, in essence, give the end product of the enzyme and make up for the deficient enzyme activity. And sometimes this can lead to significant improvements in children with autism. But the testing is available. There's a lot better genetic testing now than even 5 or 10 years ago. So you may get some answers from this, and it's worth looking at potentially. But it may not necessarily lead to a treatment. For example, a lot of the genetic abnormalities don't necessarily have a specific treatment for them, although you never know what you're going to find. So it is something to look at. But we're mainly looking at problems in biochemistry that are not necessarily genetically based.
Now, do any autistic behaviors have an underlying biomedical cause?
Yeah, this is interesting. So, the question is when you see a child having, quote, autistic behaviors, like flapping their hands, or jumping up and down, or even things like impaired speech or social interaction, what's leading to that? What's causing that? Why is that area of the brain not working as well as it should? So there's some interesting studies looking at some things that might be associated with this. For example, gastrointestinal problems like reflux or inflammation in the gut have been shown in some children to cause aggressive or self-injurious behaviors. So, for example, there's been a couple of publications on children with autism who have severe reflux or other GI inflammation who got scoped. That was identified and they were treated, and then the aggressive or self-injurious behaviors went away. There's some children who have repetitive self-stimulatory behavior when they're having unrecognized seizure activities. So some children, when they have seizure, they may jump up and down and flap their hands, or they may stare off into space. So oftentimes we'll get an EEG done in children with autism to screen for this. About 2/3 of kids with autism will have some type of abnormality on an EEG, especially if you do a 24-hour EEG. So oftentimes we're screening for this. So we're looking for some of these underlying biomedical issues that could be present that then might be contributing to overall autistic behaviors.
Now, how do you test for biomedical problems in a child with autism?
Well, the main, because these are, chemical pathways, we do tests to look at how well these chemical pathways are working. So we use essentially what are called biomarkers. Biomarkers are tests, usually lab tests, but they could be other types of tests that identify an underlying problem. The nice thing about this is you're getting some type of objective measure. For example, in diabetes, you end up with high blood sugar. So you can check sugar in the blood, glucose in the blood, and then you can follow the disease process. So same thing with this. We look at the biochemistry, and we look at end products of biochemistry to see if there's a problem somewhere. So we can do these tests, and the nice thing is these things are very objective. They give you an actual result, which you can read on a piece of paper, as opposed to something more subjective like autistic symptoms and so forth.
Now, how do you pick a treatment that targets these biomedical problems?
Well, the nice thing about the lab result is you can identify a problem and then treat it. For example, there's studies using iron in children with ADHD, showing improvement in attention and focus, with supplementation of iron in kids who have low ferritin, which is a marker of iron storage. There's a couple studies using carnitine in children with autism, showing that those who are low in carnitine oftentimes will show improvements in things like speech, muscle tone, etc., when you give carnitine. And again, you can check this in the blood to see if it's low. So we can identify these abnormalities, which oftentimes are deficiencies, and then treat based on laboratory tests. And then we can repeat the test in the future and make sure that things are improving biochemically. So something is deficient, we can repeat the test and make sure that it's now becoming sufficient.
Now, is that what is meant, or I should say, is that what doctors mean when they're talking about, a biomedical approach?
Exactly. So what we're trying to do is identify underlying biomedical abnormalities and then treat those problems and hopefully get an improvement. So, for example, in mainstream medicine, which is basically how I was trained, you target a treatment to a medical problem or symptom. For example, let's say you take a child with autism who's aggressive, who comes into clinic. The doctor might put him on risperidone, which is an antipsychotic medicine. It calms the kid down, but it doesn't treat why the child was aggressive in the first place. So what we like to do from a biomedical approach is try to figure out, why is this child aggressive? Maybe they have low cholesterol, which has actually been shown to cause aggressiveness in some children. And if you raise the cholesterol level by using dietary sources of cholesterol, sometimes the child will calm down a lot. Or maybe the child's being aggressive because they have reflux or some type of other gastrointestinal problem, and then you treat this and maybe their aggression goes down. So ideally, we would like to figure out why is the kid aggressive, what's causing it, especially if it's a new problem. Because if it's a new problem, it suggests that something changed. Hopefully identify what the problem is and then treat that. Now, of course, we have some kids that you do the test, you don't find anything abnormal that you can identify, and then you might still go and put them on a med like risperidone or some other med to calm them down to treat the symptom. But we're trying to take more of an approach looking at the biochemistry, identify problems that are there, and then treat those things which may be contributing to or causing the problem in the first place.
So I've heard you speak on evidence-based medicine. What does that mean, and how do you incorporate that into choosing a treatment?
Well, I was trained in evidence-based medicine, and evidence-based medicine essentially means let's use treatments that are based on the evidence and use treatments that have the strongest evidence. So, for example, base treatments off studies. The prototypical study that most doctors want to see is the double-blind placebo-controlled study. So double-blind means There's two treatments. One might be a particular treatment, and there's a placebo, which is a fake treatment. And double-blind means neither the participants nor the doctors know what treatment the particular study participant is getting. Placebo control means you're using a placebo in some patients. So these are the prototypical type studies that prove whether or not a treatment works. So we'd like to use treatments that are based on those type of studies, or other studies that may not be as strong, but at least there's some evidence. So we want to use things that have been proven, studied, and been shown to work for the particular condition that we're studying or trying to treat. So, of course, there may be new things that come out that don't have those type of studies, and they need to be studied, but we'd like to mostly use things that have been pretty well studied and been shown to be helpful for the condition that we're treating. That's what evidence-based medicine is based on.
So you mentioned mitochondrial dysfunction earlier as a common biomedical problem in children with autism. I want to go back to that and discuss that in more detail. Can you tell us more about the role of the mitochondria in the context of autism, and really what does the mitochondria do?
Well, the mitochondria are parts of cells. They're little organelles that are found in every cell, and most cells have hundreds or thousands of mitochondria. So every cell of the body has mitochondria in that way, and because of that, if there's a problem with the mitochondria, it can affect every part of the body. What the mitochondria are ultimately responsible for is production of energy. At a basic level, they take food that you eat or fat that you've stored and burn that and combine it with oxygen and create something called ATP, which is energy. So if there's a problem with functioning of the mitochondria, if there's something going wrong in that biochemical pathway inside the mitochondria, that can lead to low ATP production, or in essence, low energy production. So if you have low energy production, in an adult, you might see fatigue. So some patients who have chronic fatigue syndrome will have problems with the mitochondria. Or if there's a mitochondrial problem in the brain, you might see a little bit of sluggishness. For example, if there's mitochondrial dysfunction, not enough energy production in the speech area of the brain, you might not have as much speech. What's been reported recently and over the last few years, looking at brain samples taken from children with autism who died of natural causes and comparing them to typical children, is that some of the areas implicated in autism, especially areas of the brain responsible for things like speech and social interaction, are some areas where you will see mitochondrial dysfunction in some children with autism. So at a fundamental level, it's possible that not creating enough energy through the mitochondria may actually be contributing to autistic symptoms. Now, in many cases, we're not talking about a severe disease. For example, there can be severe mitochondrial problems that can actually, lead to death at a very young age in some children because, again, the mitochondria affect every cell of the body. What we're oftentimes talking about is a more mild form, so we tend to use the phrase mitochondrial dysfunction as opposed to mitochondrial disease, which is where you might have a more severe form that can lead to premature death. So the analogy here would be if you had an engine that was malfunctioning, it might be in the shop and not working at all, and you're trying to get it fixed. That would be more of a mitochondrial disease, where it's a severe problem with your engine, as opposed to more of a mitochondrial dysfunction, where maybe you're driving around town with your car, but the engine is sputtering. It's getting you there, but it's sputtering and maybe not functioning optimally. And that's what we see in most kids with autism. We talk about mitochondrial problems is more of this sort of sputtering or dysfunctional mitochondria, where they're not full-blown abnormal, but they're not quite normal either. And if you can improve functioning, you might get overall improvement in autism symptoms as well.
Now, are there tests that are helpful in identifying mitochondrial dysfunction?
So we look at several different things. You can look at the clinical history. So oftentimes you'll find things like motor delay, for example, children walking late past 15 months. You might see things like clumsiness, things like seizures, developmental regression, where you lose skills like loss of speech and social interaction are more common in children who have mitochondrial dysfunction. You may see things like low muscle tone. Gastrointestinal problems are common, for example, constipation, where maybe you don't have enough energy production has got to squeeze the bowel movement forward, so you tend to get constipated. You might see fatigue, which, obviously a 6 or 8 or 10-year-old kid should not be tired. At least, most kids are pretty energetic at that age, so fatigue is very unusual in children typically. You may get more severe things. There's something called ataxia, where there might be some difficulty walking. The child might be off balance. So we look at the clinical history and look at the developmental history. So, is there a regression or something else going on? When did the child walk and talk and so forth? We look at family history. Occasionally, you'll find a family history of mitochondrial problems, not typically, but sometimes. And then we can do objective testing with laboratory testing. For example, the 2 most important blood tests, at least from a mitochondrial standpoint, are lactic acid and alanine. In fact, both of these are used in one of the diagnostic criterion to diagnose mitochondrial disease. We also look at things like ammonia, carnitine, isocarnitines, which is essentially the fat that you burn inside the mitochondria. We look at something called creatine kinase. You can look at coenzyme Q10 levels. Obviously, these are laboratory tests that your doctor can order. These can be done through Quest or LabCorp, so usually insurance will cover them, and they may be abnormal and point to signs of mitochondrial dysfunction.
So what treatments are available for mitochondrial problems?
Well, pretty much all the treatments available for mitochondrial problems are nutritional supplements. So if you look at physicians who specialize in mitochondrial disease, most of the things they're recommending are mitochondrial or nutritional supplements. So you probably heard of mitochondrial cocktail, which is a mixture. This is different supplements you might use to help the mitochondria function better. Certainly you can target underlying defects. For example, if you have low carnitine or low coenzyme Q10 in the blood, which you can measure, you can certainly add those in as treatment. In fact, the two most important treatments for mitochondrial problems are carnitine and coenzyme Q10. In fact, there's two double-blind studies comparing carnitine to placebo in children with autism, where essentially they took a group of kids with autism, put half on carnitine, half on placebo, and the kids that went on carnitine had a significant improvement in things like speech, cognition, muscle tone, even if their carnitine level in the blood was normal. In other words, they still seemed to respond to it. And you can measure carnitine in the blood, again, which can be quite helpful. And again, these are double-blind placebo-controlled studies using a fairly high dose of carnitine, about 50 to 100 milligram per kilogram per day, which is the dose we might use for mitochondrial problems. So again, carnitine is a big one as far as a nutritional supplement that can be helpful both for autistic symptoms, but also for treating mitochondrial problems.
Now, how do you determine which treatment is appropriate for a child with autism or any other developmental condition for that matter?
Well, that's a good question. I mentioned the biomarkers, laboratory tests. So if something's low, you might give it, or something's high, you might take it away. We try to use evidence-based medicine, so pick treatments that have been studied and been shown to help the particular symptom. For example, there's a laundry list of different supplements and medications that have been shown to increase speech in children with autism. So if your child has a speech delay, you might add in something like that. For example, the number one study supplement for speech in autism is carnitine. So then we're not randomly grabbing something. We're actually using things based on what's been studied or based on a laboratory test. And we can then target the treatment. So every child with autism is different, and we don't want to give every kid the same treatment. So we want to be able to target the treatment to the individual child, and that's where the laboratory testing and so forth can be so helpful.
So it sounds like you're not really treating autism per se. It's more of a descriptive diagnosis, but that you're really treating the underlying problems that may be contributing to autism. Would that be an accurate assessment?
No, that's a good point, and that's exactly what we're doing. Because we consider autism a behavioral diagnosis, again, based on a group of symptoms, and this is treated with behavioral therapy, for example, ABA therapy. What we're looking at is more underlying abnormalities that might be contributing to or even causing autism. So again, we don't always find a problem, and we may target treatments with medications or things based on the symptoms, but we're still looking for these underlying issues that might be contributing to the problem in the first place. So we're treating these underlying biochemical abnormalities and not necessarily the autism per se.
So I've heard some doctors say this, which for me personally is annoying, but they say that there's no evidence that nutritional supplements can help autism. Can you respond to this?
Yeah, I'm very interested in this. I mean, when I first got involved in autism, I remember going to other doctors who specialize in autism, talking to them, because I was interested in treatments that might help my child or my children. And I remember talking about diet and certain supplements and even certain medications, and being told that, there's no evidence that these treatments help and so forth. And then going to conferences, talking to other doctors and so forth, I found a few studies that were out there, and then I got interested and then I started going to the library myself and looking at this type of research. So I've been compiling research over the years, looking at both supplements and medications, but other things that would help to treat autism and other developmental conditions too. So last time I've looked and last time I've compiled this, there's 111 published studies looking at 20 different nutritional supplements on autism. For example, if you take melatonin, there's 22 studies that have looked at melatonin, and 6 of these studies are double-blind placebo-controlled studies, all reporting improvements in things such as the time it takes a child to fall asleep, the number of times they wake up at night, the length of sleep that they get, just using something as simple as melatonin. In fact, one study reported that melatonin levels were generally much lower in children with autism compared to typical kids. So oftentimes we'll use this as a supplement to help with sleep. So even though there's 6 double-blind studies and 22 total studies, there are still some doctors saying, hey, melatonin has not been shown to be effective. And they may not be, they may be well-meaning, they just may not know the literature. So one of the things that we've been trying to work on is getting this information out, trying to publish studies, reviewing these type of treatments so that more doctors are aware of kind of what's out there and what can be used to help.
So which nutritional supplements have the most evidence for effectiveness in autism?
One of the things that I've been working on, and some of the doctors with me, is trying to sort of rank these different treatments, which ones have the most evidence. And if you look at the number of studies that have been published and so forth, you can kind of make a list of which ones have the best evidence. If you just look at nutritional supplements, the strongest supplement in autism is definitely melatonin, which I just mentioned. Other ones in order of studies are carnitine, something called N-acetylcysteine, folinic acid, which I mentioned earlier with treating cerebral folate deficiency, multivitamin, which is a specialized multivitamin at a little bit higher dose than what you might get in, say, a Flintstone, probiotics, an antioxidant called carnosine. There's another antioxidant called sulforaphane, which is a broccoli extract. So these have pretty good evidence, mainly based off multiple studies or double-blind placebo-controlled studies.
So what about medications? Do you use medications in children with autism? And do these medications, I guess, do they target any of the underlying biomedical problems?
Yes, I use medicines. I mean, obviously, we like to use simple things first. So oftentimes, in most kids, especially younger kids, we'll start with supplements, might start with dietary changes and so forth. So children who are younger, we tend to start with simple things. Children who are higher functioning, that aren't as severe to start out with, you might start with simpler things. Children who are improving well over time, who maybe are doing therapy, a few supplements, whatever, and are taking it off and starting to improve more, we're not going to tend to run out and put them on medication. So I tend to use medications more in children who maybe are older, maybe they're lower functioning, maybe they're not improving as quickly as we want, so where we might start, again, with simple things and move into some medications as we go along. Some of these medications, treat the symptoms. I mentioned risperidone, which lowers aggressive behavior or irritability. So you might have to use a medication like that. But there are some of the medications do seem to target some of the underlying biomedical problems that you find in autism. For example, a deficiency in oxytocin has been shown in some children with autism, and this can lead to social interaction problems and can be treated with oxytocin nasal spray, which you can get from a compounding pharmacy. There's other medications like some of the Alzheimer's meds that have been studying autism, like memantine, which is Namenda, and galantamine. These both have double-blind studies and other studies showing that they can be helpful for things like speech, social interaction, attention, and so forth in some children with autism. And these two medications in particular target some of the neurotransmitter imbalances that you can see in children with autism. So some of the meds do target underlying biomedical problems. Other ones are more to treat symptoms. And so we may go to medications in some children if necessary. The general principle that I have is if it takes a medication or a supplement or a dietary change or something else to help the child improve, then so be it. But we're going to generally start with simple things in most children.
So what medications have the most evidence for being the most effective in autism?
Well, I mentioned at the beginning aripiprazole and risperidone. Those are the two antipsychotic meds that are FDA-approved for treating irritability associated with autism. So obviously those have studies behind them. Barring that, all the other medications and supplements, for that matter, are non-FDA approved, so everything we're talking about is considered off-label. Although in medicine, probably more than half of what we do is considered off-label. So a person who goes to their doctor who has migraine headaches and gets a seizure medicine to prevent future migraine headaches is using a medication, i.e. the seizure medication, off-label. It's not approved to treat migraines, but you can use it that way. So oftentimes in medicine, we're using things off-label, using it for a condition that wasn't approved for. But as far as medications that have most effectiveness in autism, number one would be oxytocin, which again you can get as a medication from a compounding pharmacy. The second one would be naltrexone. There's been about 25 studies looking at naltrexone and autism, mainly for self-injurious behaviors, aggressive behaviors, hyperactivity, self-stimulatory behaviors, and so forth. Other meds that have been pretty well studied include propranolol, fluoxetine, which is Prozac, atomoxetine, which is Strattera, which is an ADHD medication. I mentioned earlier memantine and galantamine, which are Alzheimer's-based meds. A few other meds, one called pentoxyphylline, which has some novel anti-inflammatory effects. Amantadine, which is an old flu medicine. Bumetanide, which is a diuretic. Some of these have been studied in autism, including in double-blind placebo-controlled studies, and appear to be promising.
So I was at a conference once, and I heard you use the acronym STEPS, STEPS, when discussing treatments. What does this mean?
Well, this is something I learned in residency, and I think it's quite helpful for both physicians and patients as far as choosing treatments. STEPS stands for safety, tolerability, efficacy, price, and simplicity. It really goes in that order because safety is the most important thing. So when we look at any particular treatment, we're going to look at this acronym. So, is the treatment safe? Has it been studied in children? So, for example, some doctors don't like to use melatonin because they're not sure if it's safe or not in children. But again, we mentioned the 22 studies using it in autism, and most studies report that it's pretty safe, and not going to be harmful. The second thing is tolerability. Something could be somewhat safe, but maybe your child doesn't tolerate it. For example, if every time they take a treatment they vomit, you may not be able to use it. So is the child going to tolerate it? And of course, that might vary person to person. That's more of the side effects. So that's the second most important thing to look at is, does the child tolerate it? Did the studies seem to indicate that it will be tolerated? Efficacy. So obviously that means, does it work? That's very important, of course. So you don't want to use a treatment that doesn't work. So you want to use treatments that have been studied. So again, if you go back to melatonin, there's quite a bit of evidence that it's helpful in most kids with autism who have sleep problems. Price, so not quite as important, but certainly is a factor. So if something costs a few $1,000s a month, and it's not covered by insurance, you may not be able to afford it, and it may not be something you can use. And then simplicity, that's probably the least most important thing, but is something to look at as well. So if a child has to take a treatment 6 times a day, on the clock, that's going to be pretty hard to do as opposed to taking it once a day. So what we want is treatments that are safe, that are tolerable, that don't have a lot of side effects, that have been studied, been shown to be effective. Obviously that'd be nice if they're not super expensive or they're covered by insurance, which is helpful. And it'd be nice if it's fairly simple, take it once or twice a day. And the most important thing, again, being safety.
Now, what about behavioral therapies? What are your thoughts on these?
Well, behavioral therapies are extremely important. In fact, this is the first treatment that we did for our kids with autism. We started behavioral therapy right away. So I think it's foundational. The major treatment that's been studied, or major therapy that's been studied in autism, is applied behavioral analysis, which is ABA therapy. So this has been proven to help children with autism in multiple studies. It's foundational for treatment, and it helps to reshape or retrain the brain. What we're trying to do with the biomedical treatments is identify problems that might be present in the biochemistry that might actually be impairing brain functioning or maybe impairing other things like gastrointestinal functioning, and add things in or treat things that might help the brain function better, so now therapy works better. So I think what we see in most kids is that the most improvements can be made when they're doing biomedical treatments to address underlying biochemical issues so that the brain works better, and then train the brain using therapy like ABA therapy.
And okay, so now at one of your recent talks, I heard you use the phrase achieving optimal outcomes in autism. I actually think that was the title of your talk. What do you mean when you say this?
So, you've probably heard of some kids who have improved. Some people use the term recovery, where maybe the child no longer has autism and so forth. It's somewhat controversial, though now there's quite a few studies showing that some kids with autism do recover or improve. What we want to do is we want to try to optimize the outcome in the child as best we can. We know that not every child is going to get to the point where they're indistinguishable from typical kids at so-called recovery. But what we're trying to do is maximize the functioning in each child, and we want to treat the underlying medical problems that are present. We don't want to necessarily change the child. We don't want to change their personality or change who they are per se. But what we want to do is we want to identify these underlying medical problems, biochemical problems, that we can then hopefully improve and therefore lead to better functioning so that the child can think better, so the child's not in pain, it doesn't have, not having a lot of gastrointestinal problems and so forth. So what we do is we use a combination of things such as evidence-based medicine, laboratory testing, obviously treatments to try to get maximum improvements in the child, and that's what we mean by achieving optimal outcomes. It does take time. It's a process. Some people use the phrase, it's a marathon and not a sprint. So sometimes parents have expectations that are tough, where they might expect improvements in a month or two, dramatic improvements, where it may take longer than that. It may take a year or two or longer, especially with using a combination of behavioral therapy and biomedical treatments. But the point is we're hoping to get improvements over time and get the child to optimize as best we can.
Now, the next question I have, this is a question many parents ask, especially those either wanting to have another baby or, thinking of having a baby now. Is there anything parents can do that might reduce the risk of autism if they're planning on having a child?
Yeah, I get asked this a lot because obviously, parents are thinking about having other children, and they may already have a child or two affected in the family. There's nothing that's proven at this point, although there's a lot of things that we think you can do just based on studies to date. For example, vitamin D deficiency seems to play a huge role in developing autism, and so a lot of women, a lot of people in the U.S. are vitamin D deficient if you're not taking it. So oftentimes what we'll do before a woman becomes pregnant is try to look at some of these things, like is she low in vitamin D, and maybe if we raise it to normal, that will be helpful. Again, that's not been proven to prevent autism, but it sort of makes sense and something easy to do. There's some evidence that these folate receptor antibodies I mentioned earlier, the antibody that blocks uptake of active forms of folic acid in the brain that can lead to low active forms of folic acid in the brain, are present in some of the moms, and these antibodies can cross through the placenta into the baby and maybe affect the ability of active forms of folate to get in the baby's brain. So we tend to use higher doses of active forms of folate during pregnancy, and that might be helpful in preventing autism as well. Again, not proven, but makes sense. There are some studies showing that women who take high dose of omega-3 fatty acids in pregnancy tend to have children who have higher IQ. There's a little bit of evidence that supplementing with iodine might be helpful in preventing autism. So we tend to look at some of these things that you can do ahead of time that might reduce the risk of autism. And usually we try to start a few months ahead of time where we do these tests in the parents, especially the mom, identify the problems, then gives a few months to correct the problem before they become pregnant. Even, I mentioned earlier, pesticides during pregnancy being associated with autism, so things like avoiding pesticides, avoiding chemicals, maybe eating organic food, these are all things that might be helpful too. Of course, there's only so much you can do. You can drive yourself crazy trying to avoid everything, but you do what you can and then leave it up to God at that point. So.
And if you're already pregnant, you can still implement some of these tests and suggestions you suggested.
Yeah, that's a good point. So I have parents that come in the clinic and mom's already pregnant and wants to know what else they can do. So you can check some of these things. Even things like hypothyroidism. So there's some evidence now that hypothyroidism in pregnancy can play a role in autism. So you want to make sure the thyroid is in good shape and so forth. So you can check vitamin D and thyroid and some of these things during the pregnancy even, and optimize things as the pregnancy goes along.
Now, where do you see autism heading in the next 5 to 10 years?
Well, unfortunately, the autism rates seem to keep going up. Every time there's a new data released, it's higher rate. So it doesn't seem to be slowing down much at all, which is obviously not what we want to see. I think medicine in general is moving more towards this sort of concept of personalized medicine, where you're basing your treatments off biomarkers, laboratory testing. A lot of mainstream doctors are looking more at the genetic side of things, but I think over time we'll hopefully be better at identifying different subgroups of children with autism. Maybe this child predominantly has a mitochondrial problem, maybe another child has predominantly more of an inflammation problem and so forth, and being able to more quickly add in treatments that might be beneficial based on testing as opposed to randomly trying things. So treatments that are targeted at some of these underlying problems, I think, will be something we're looking at in the future a lot. The good news is there's a lot of research going on, so I try to keep up with the research at PubMed, and so I go there usually once or twice a month and look at the new studies that have been published, and it's pretty hard to keep up with it now. It used to be fairly easy. 10 years ago, a study would come out, and it would make a lot of noise and so forth. Now there's so many studies coming out, it's hard to keep up with it, which is good. That means there's a lot of research going on in autism, and obviously we need more.
Absolutely. And, I talked about my next question a couple of times with some of the other speakers that I had on the summit, and but I'd love to hear it from you. Tell me about M.A.P.S.
So M.A.P.S. stands for Medical Academy of Pediatric Special Needs, and it's a group of doctors who have come together and other medical professionals to treat autism, but other developmental disorders too, whether it be cerebral palsy, Down syndrome, ADHD, and so forth. Even things like allergies and asthma, things that might affect most or some children who are out there. And what we're focused on is training doctors and other medical providers on using a biomedical approach. So again, doing laboratory testing to identify these problems and then treating. So, for example, if you don't do the test, you may not find the problem. If you don't check the thyroid test, you may not know there's a thyroid problem. So we review the literature that's out there on different testing and so forth, and try to come up with this sort of consensus that we all agree on to some degree. And then we also, M.A.P.S is based on evidence-based medicine, so we really want to focus on things that are proven. Doesn't mean that doctors aren't going to go out and do things that they've heard about that is new, that doesn't have a lot of evidence, but we want to, as much as possible, try to focus on things that are more proven as opposed to things that are more speculative. We do have speakers from academic institutions, actually multiple ones, and these docs are involved in research and so forth, so we have up-to-date information on the latest research. We also have speakers who have a lot of clinical experience who've been treating children with autism, children with ADHD, children with other neurodevelopmental problems for decades who speak at the conference. And we work with parent groups so to get the word out there. So what we're aiming to do is to treat doctors, medical providers on taking this biomedical approach to treating autism and other developmental problems.
So basically, when I think of M.A.P.S, I think of it as a place where parents can go, kind of like a go-to place when they're looking for doctors that are specialized in autism and other things for, I guess, pediatric special needs is the name of the group, right? So, but would you recommend if you first get the diagnosis, this is where parents should look? This is what I typically recommend them to do is go to M.A.P.S. Is that something you would recommend?
Yeah, I think so. I mean, I have parents who come in, who the child is newly diagnosed with autism, and they've been spinning their wheels. They're kind of frustrated. They've maybe gone to the local doctor or pediatrician, and they aren't getting what they want. Some of the biomedical treatments, which is understandable because unless you really take an interest in this, you're not really going to be up to date or know what tests to do and what treatments to do. So you can't expect that a busy family doctor or pediatrician is going to be up to date on all these different issues. So again, you can certainly try to get things going with your local physician, but if they're not kind of up to date on these things, you may be spinning your wheels for a time. So I think just starting out from the get-go with somebody who's been trained through M.A.P.S can save you a lot of heartache and time, get the ball rolling. So again, it's a good place to start, I think, especially with some of the testing to identify some of these things early. Generally what we find is the younger the child is when you identify these problems, and the earlier you treat these problems, generally the better the outcome is going to be. So waiting until the child's older is usually not what we want to do. In fact, there's a major problem in the United States right now, I think, in some places where children who come in who have autism or who have symptoms of autism are being told, oh, wait, give another 6 months, maybe things will just get better on its own, and the parent ends up waiting, and then the treatments are not going to be as effective. So the sooner we can start, even before the child has a diagnosis, if there's just a delay of some sort, we still might look at some of these underlying biomedical problems. So whether the child has autism or developmental delay or ADHD, doesn't matter as much to us as far as what the label is, because what we're looking at is the underlying biochemistry, and you can look at that even in kids who are under a year old. So kids maybe that are slipping a little bit, maybe a little delayed, you can look at these things, hopefully optimize things, and hopefully have a better outcome, as opposed to waiting until you have a firm diagnosis and then maybe the child's older and still might respond to treatments, of course, but maybe not as robustly as if they were younger. So.
And the website for that is medmaps.org. For those listening, if you guys want more information about the Medical Academy of Pediatric Special Needs. Gosh, Dr. Rossignol, I so enjoy talking with you, and I just feel like you're just so knowledgeable, and we're so lucky to have you in our community. If people want to find out more about you, where do they go for that?
Well, they can go to my website, which is rossignolmedicalcenter.com. And that's my website where I have most of the papers I've written are on that website, and there's a place where they can contact us if they're interested in appointments and so forth.
And then you also, you are kind of part of M.A.P.S as well, too, so they can find out more information about you there as well?
Yeah, so M.A.P.S, M.A.P.S.org, and they can see the upcoming conferences and so forth. And we have a list on that website of different physicians who have been trained through M.A.P.S or have taken M.A.P.S courses, so they can hopefully find someone in their area. Because we have, I think, over 700 doctors so far who've trained through M.A.P.S.
Wow. So that's rossignolmedicalcenter.com or medmaps.org. And do you have any, I guess, last words for the families out there that you want them to be left with after our talk today?
Yeah, I think there's a lot of hope. My kids are 14 and 12, and they've improved a lot over the years. But when I see what's available now compared to, say, 12 years ago, it's night and day. I mean, there's so much more is known about the biochemistry, about the testing, about the treatments that are available. Obviously, we have more research to do, but just what we know now can make a huge difference. I remember when my kids were diagnosed, especially my older kid, because it hit me, out of the blue. I didn't realize he had autism. It was devastating, and you don't really know what to do. But there's hope. So a lot of these kids do improve. Not every single one will, but a lot of them do, especially if you can identify things when they're young and start treatment. So there's a lot of hope. I think right now, a lot of physicians who maybe don't know much about autism treatment will tell you that, hey, it's lifelong. There's nothing you can do about it. Move on with your life. And I think that that's not true. That there is a lot of hope that these kids can improve. And again, we're trying to treat their underlying medical problems, not change who they are as a person fundamentally. So.
Wonderful. Well, thank you so much for everything you're doing in the community, and just thank you for taking the time out of your busy schedule to talk to all the listeners today.
I appreciate it. If you have a child with autism, there's a reason. So God doesn't allow things to happen without a reason. So in my case, it was because I could help other people who are affected like I am, and that's kind of what life is all about. So God bless you, and I appreciate this opportunity.
Thank you, Dr. Rossignol.